Well, the worst job in nursing, in a system that's driving people mad. That's the view of a mental health nurse who's broken her silence to talk about working inside Australia's immigration detention system. Ina Grigg has told Lateline she saw despair and self-harm every day while caring for detainees at the Northern Immigration Detention Centre in Darwin. She says that when she showed concern for her patients, she was told to harden up. Ina Grigg's personal account of a system under pressure comes as more people are being released into community detention and a large new detention centre is about to be opened. Karen Barlow reports.
Ina Grigg has been in nursing for almost 40 years. This year, motivated by a desire to see more of Australia, she signed up to a 3-month contract to work at the Immigration Detention Centre in Darwin as a mental health nurse.
I wasn't really supportive of people coming to live here that way. I used to say, I was probably one of the first people to say, why don't we just send the boats back to where they come from, and then that'll stop them. But it was my ignorance and I feel really ashamed that I thought that way.
2 weeks in, after being presented with depression and self-harm every day, her worldview turned around. Ina Grigg now believes mandatory detention is wrong.
Being locked in a prison with not knowing how you're going to get out or when you're going to get out or why you're even there and not getting any answers as to how they can get out is driving these people mad.
Ina Grigg says detention is sapping people's will to live. She was dealing with severely depressed people every day, a situation that she still finds traumatising.
Well, for me, I found it very depressing, very despairing, just the level of despair that seems to ooze out through the floor and through the buildings everywhere. And I've seen people write rude things on the wall in their own blood. I've seen people cut things on their hair, cut their hair in, what FU in their hair and that on the wall. What else have I seen them do? Oh, just cutting themselves.
It's rare for a frontline worker inside the Immigration Detention Centre to speak out. Staff sign confidentiality agreements, but Ina Grigg says she wants Australians to know her story and her concern for the mental health care of asylum seekers.
Harden up. Literally, I was told to harden up. But no, I can't do that. When I see despair, I'm driven to do something to stop it. And I just can't rest. I can't go home at the end of the day when somebody's threatening to hang themselves. I have to stay there and talk to that person until he can come down. I can't stand looking at that sort of stuff.
Look, I think Ina's very brave speaking out in relation to her experiences in particularly the Darwin Detention Centre. Basically, people are scared to speak out about their experiences.
The Australian College of Mental Health Nurses says Ina Grigg's story is not an isolated one.
But I think from what I understand in relation to the services being provided currently in the detention centres, they are less than any standard that we have across any other service in the country. And I think people are feeling very compromised in relation to their own practice standards and their own ethical standards.
The private company that's contracted to provide healthcare in detention centres has admitted it is being stretched. International Health and Medical Services, or IHMS, wrote to the Immigration Department in October, proposing better access to a pool of psychiatrists.
The increasing surge in clients, particularly in remote locations, has placed stress on the limited network of providers.
A new mental health policy was introduced in November 2010, called the Psychological Support Program, or PSP. It's supposed to identify and support immigration detainees who are at risk of self-harm and suicide. There are concerns it's not been implemented properly.
We've got a very fragmented detention system. We have very remote locations. We have rapidly changing staff, high staff turnover. So there have clearly been some issues in making sure that all staff who need to know about this policy and work within it have had the training and support that they need.
The Immigration Department says mental health policies continue to be reviewed with experts, and mental health training has recently been revised and delivered to staff across the detention network. It says it and the contracted company IHMS ensure people in detention have access to mental health nurses, psychiatrists and psychologists at a standard equivalent to that available in the general Australian community. Large boat arrivals over the past year have taken the Immigration Detention Centre population to around 5,000. The federal government has moved to ease pressures by announcing at least 100 bridging visas a month to asylum seekers who arrive by boat.
At the moment, we're waiting to see, of course, the potential impact of these changes as they become known on the number of arrivals. It's likely that they will be continuing at least at the same level, if not more arrivals. That's somewhat unclear.
Mental health nurses say they're concerned about damaged people being released into the community.
Approximately 90% of these people at some point will be given a visa to remain in Australia. And whilst we're not providing them the mental health care they require now within the detention centre, it will be the responsibility of the community to pick up that cost and that bill in human costs when they go out to live in the community.
Ina Grigg fears the anger and mental health distress of asylum seekers are setting them up to fail when they enter the community.
They're frustrated, they're hurting, they need support and sustenance like the rest of us. And I think that's been the biggest thing for me, to realise that, hey, we're no different than anyone else. Just because we're Australian, we're no better. And when I see what we do to these people, I think that we're just as bad as what their countries are.
A new immigration detention centre will soon open near Darwin to cater for 1,500 single men. The Immigration Department hopes new activities at the centre will reduce the stress of indefinite detention. Karen Barlow, Lateline.